Hello everyone, I continue to talk about nose types that my patients want from me. Today we will see Kelly Rowland type of nose. When my patient wants, doctor, I want that kind of nose, she is one of the common nose type that I see in my practice that my patients desire. When I assessed her nose, first we look the bridge part, soft but structured look. It's not very high. Tip part is sculpted and narrow tip look, especially with the makeup you can see better definition. The delicate eyelid base that blends naturally into her cheeks, but it's really narrow, looks narrow. Consistent tip support, not very weak, and smiling, of course it's flaring, but not too wide. Those are the main characteristics that I see in her nose. This nose works beautifully with her heart-shaped face, looking natural and keeps preserve her ethnic look, which looks great. But the question is, can everyone achieve this look? Of course not. Skin thickness, sebaceous quality is one matter, because when see her nose and photographs that I see in my practice, it's shining, it's a tiny skin. So if you have a very thick skin, oily skin, it doesn't redrape over the nasal skeleton and it doesn't look like that. That's the realistic expectations are important. But with quality skincare, and if you have some, overweight, it's good to lose weight healthy, which is going to shine your skin, and of course definition will look better. If you want a similar approach, similar shape, what we are doing, if you have a flat nose, it's good to raise it with cartilage graft, cutting the bones on the side to make it narrow. We call this osteotomies. And again, tip must be supported. It has two effects. First, it gives some definition to nose, because it gives a consistent support. And the second, especially when my mimetic muscles are working, it doesn't flare too much, it doesn't go down too much. Of course, eyelid base reduction is another point. Eyelid base is naturally a little bit wider than the distance between your eyes. So if it's too straight, it may look unnatural, and it must be a little bit wider. Of course, also it's different with men and female. So when we do eyelid base reduction, it must come a little bit wide. Too flat eyelid base, too flat, cause triangular nostrils, which I find it a little bit unnatural for especially African and Asian patients. But the important point that I always say, it's good to enhance your own anatomy, not just chase someone else's body part.